King Wetp is us we the people.
Here's part of an article in the New York Times on February 23, 2019. Even before Democrats finished drafting bills to create a single-payer healthcare system, the healthcare and insurance industries have assembled a small army of lobbyists to kill Medicare for all. Good evening. Tonight we're going to talk about the fight we're going to have in trying to get our healthcare costs in line with the rest of the world. It will be a big fight. The healthcare lobby has a lot of profit at stake.
Socialism.
They will bring out the big guns and fire the BS and slogans.
You will wait for a doctor.
More BS. Commonwealth Felton data shows 8% of emergency room patients in the UK waited for 4 or more hours. However, in the United States, 11% of emergency room patients waited 4 or more hours.
Big government.
More BS. It's not about big government or small government. It's about good government.
Government and bureaucrats.
What we have now is insurance companies dictate medical treatment, not your doctor. There's in-network, out-of-network, and get permission for surgery.
Death panels.
More BS. Medicare's been around 50 years, and there is no death panels. What is the quality of healthcare like in the U.S.? Of the 22 countries we've been comparing ourselves to, we come in second to last. In the world of 192 nations, we come in number 37. Let's take a look at some of the different specific categories. With the exception of Canada and Sweden, patients in the United States have a harder time making a same-day appointment when in need of care. In 2016, 51% of patients in the United States were able to make a same-day appointment with a provider, compared to 57% of patients in similar countries. The United States has higher rates of medical, medication, and lab errors than comparable countries. The United States is about the same for mortality rates of the circulatory system that have fallen over the last 35 years. The United States is about the same for mortality rates for cancers. It's pretty much the same as comparable countries. The mortality rate for respiratory diseases is higher in the U.S. than in comparable countries. The 30-day mortality rate for heart attacks and strokes are lower in the U.S. than in comparable countries. The U.S. has poorer rates of amenable mortality as measured by the Healthcare Access and Quality Index. Use of the emergency room in place of a regular doctor is more common in the U.S. and Canada than most of the other countries. Let's summarize. We are 37th out of 192 countries. We are 22nd out of 23 modern countries. We do better in some areas, but worse in others. But the differences in these areas are small and really insignificant. So the quality in the U.S. versus other comparable countries is not the issue. But where we have a huge difference is the price. What are the odds? The fat cats and lobbyists are even money. We the people are a long shot. At the Capitol in Washington, the lobbyists will talk to the congressmen and senators. The right-wing think tanks will weigh in. Heritage Foundation, Hudson Institute, Freedom Works, Cato Institute, PragerU, American Enterprise Institute, Pharmaceutical Research and Manufacturers of America, Lexington Institute, the Hospital Federation, and they will be spinning the facts and the truth. They will tell you to dismiss the obvious. 22 other modern countries that all pay half of what we pay. This fight over healthcare is not a red state versus a blue state. If you're a conservative, you're getting ripped off. If you're a liberal, you're getting ripped off. If you're a Republican, you're getting ripped off. If you're a Democrat, you're getting ripped off. If you're an independent, you're getting ripped off. If you're a farmer, you're getting ripped off. If you're a mechanic, you're getting ripped off. If you're a policeman, you're getting ripped off. If you're a teacher, you're getting ripped off. And if you're a businessman, you are really getting ripped off on the health insurance for every one of your employees. In 2000, an individual health policy cost $2,471 or $206 per month. In 2017, it cost $6,690 or $557 per month. A family policy in 2000 cost $5,791 or $482 per month. 2017, it cost $18,764 or $1,567 per month. Businesses are really getting ripped off. And as you can see, these price increases have far outstripped inflation. So, who is paying too much for their health care? All of us. Who is getting ripped off? 327 million of us.
I get my insurance from where I work, so how does it cost me more?
We have to pay part of it, and the company picks up the rest.
Yeah, and my deduction is $145 every paycheck.
Yeah, and when it goes up every year, it also affects our raises.
January, our health insurance is going up 6%.
Well, we will have to limit raises for next year.
We can also increase the employee share.
But here's the scary part. Your auto insurance coverage is based upon the day of the accident, but your insurance coverage is based on the day you received the medical service.
I broke my leg skiing, and I also had a concussion, so I can't work, and I now lost my job and can't afford the health insurance.
Your health insurance has lapsed. How do you plan to pay for the MRI?
I thought I had insurance, but when I got hurt I couldn't work. They wanted $700 a month to continue the insurance and I was not getting a paycheck. Oh, that's terrible. And now the hospital wants over $50,000.
So why are the odds against us from winning the fight? Congress. The last time in 2009, when the Affordable Care Act was being worked on, Obamacare, President Obama wanted to include a provision called the public option. The insurance lobby knew it would mean the end, and we would have a single-payer system. They already had the Republicans in their corner, so they lobbied the moderate Democrats and got it removed from the bill. The insurance industry knew if Congress failed to create a public option to compete with the private insurers, the bill it sent to the president might as well be called the Insurance Industry Profit Protection and Enhancement Act. So if you want to win this fight, you need to talk to your congressman and senator, especially if they're Republican. And don't forget, share this with your Facebook friends.